So today we just take a look what is Hartmann's operations. The Hartmann procedure is the procedure where we dissect the rectosigmoid colon with the closure of the anorectal stump and formation of the end colostomy. Understand? There is three things. First, we have to resect that rectosigmoid part of the colon, which is usually affected in case of that diverticular, colonic diverticular. Then we have to close that these remaining anorectal stump and leave like that, and create, and the third thing, and create and colostomy means part of the colon, create an stroma in the abdominal wall and open outside through colostomy. So there are three important things in the Hartmann's procedures: resection of the rectosigmoid part of the colon, closing of that anorectal stump, and third, the create and end colostomy. The procedure is done with laparotomy, means we have to do by open. Just left lateral midline incision is required for that, and just to find the after entering in the abdominal cavity, just look around. If there is a perforation in acute condition, then we have to first close that part and then clean the complete abdominal cavity, and then we think about what to do. If only a small part is infected, then resection and anastomosis will be enough. But in Hardman's procedure, when the rectosigmoid part is very much effective and the bowel part of bowel is not viable, in that condition we have to resect that part of the bowel and closing the anorectal stump and create an opening in the abdominal anterior abdominal wall and attach to that part of the colon to that and create a colostomy. This procedure was very helpful for the patients with the bowel cancer, perforated diverticulitis, complicated case of bowel obstruction. Means when the part of the bowel is to be resected, in that conditions, Hartmann procedures will be very useful. So here you see that this is the colostomy wound created over the abdominal anterior abdominal wall, and this is the colostomy wound, and this is the colostomy bag. It comes in the market, so you can advise your patient just attach the bag, and whatever the food material, that fecal material, it collects in this bag, and daily to daily or daily 1 or 2 times according to the bag when the is filled, patient can change with another bag. After 6 months or uh, it condition can be reversed and the colostomy can be closed and reversed the anastomosis of the anorectal stump to the that part of colon in second procedures. Usually it is required in the older conditions. Patient with the older age, usually that reverse is not done because that the patient may not uh, capable to underwent such kind of surgery. But in the younger patients, it is must to reverse the conditions. Older patient can live with this, but young patient cannot live with long life. So in the younger patients, the reversal process is always done, but in elder process depends on the conditions. The complication of the pulmonary diverticular includes the recurrent periodic inflammation that causes the pain and diarrhea, dysentery, and other discomforts. Perforations leading to generalized peritonitis. If once the part of bowel is perforated, the intestinal content comes into the abdominal cavity, and that may leads to the infection, and that causes the inflammation of the peritonitis, visceral peritonitis as parietal peritonitis. intestinal obstructions, hemorrhage, and fistula formations. Vesicopolyfistula means fistula from the urinary bladder to the colon. Vaginopolyfistula in the females, vagina is communicated with the colon. Enteropolyfistula when the intestinal small intestine has communicated with the large intestine, and the colocutaneous fistula when the colon is having an external opening around the skin, that is also called fecal fistula. So these are different kind of fistula which can be developed as a complication of the diverticulitis. So here we end the disease of the diverticulitis, disease of the intestine. In the part of the disease of intestine we have covered till that diverticular disease.